I'm Shirley McNicholas and I'm the Women's Lead for Camden and Islington Foundation Trust. I'm the founder of Drayton Park Women's Crisis House. I started working in mental health in 1987 in a big old psychiatric hospital, and really through my training and through my experience did not feel that any of these ways of working with people was the kind of way I would want to work with people. So I was a ward manager and I ran a day hospital and various things, and I was fortunate enough that in 1994 I was approached to develop 2 crisis houses, one of which was Drayton Park. So I founded an advisory group made up of women who use services and women and men who were committed to providing women an alternative to hospital.
I've been working at Drayton Park now for almost 7 years, and what I like the most is that we treat each and every woman as an individual and not as someone who occupies a bed.
I think there are real benefits in having an alternative to hospital for many people who would prefer to stay in a residential crisis house as opposed to staying into hospital, but they're not in competition with each other. So crisis houses, like crisis teams, are alternatives to hospital admission. They're not an equivalent of an inpatient admission.
There are some women with severe and enduring mental health problems that might feel the need to either to go to a hospital or to any other crisis house, and they're not able to do that because they don't have the female-only option in order to feel safe.
Luckily, in terms of the trust, nobody in the trust has ever said, actually, this should be a mixed team, why is it women-only team? There's never been any appetite to create women-only teams in other services, but there hasn't been a challenge about being a women-only team. There are kind of myths about, men aren't welcome here, men aren't allowed, everybody here is a lesbian, all kind of laughed at the notion. We do quite a lot of body work here, so we have 2 massage therapists who are fantastic trauma-informed massage therapists who do really good body work, and kind of comments about, I suppose you think massage cures schizophrenia, that kind of thing, which really has stopped, but we've had to kind of put up with that until we demonstrated that we were a robust, safe service.
They don't treat you like a diagnosis, they treat you as a person, and they want to hear about your story rather than what's wrong with you. 12
women can stay at Drayton Park at any one time, and up to 4 children can stay here. Obviously there's a turnover, so in an average month there would be about 20 women who would come and stay, because obviously people are staying for as short a time as possible. The admission process, really, we need to start with the referral process. So 24 hours a day, anybody can pick up the phone and self-refer, make a professional referral to Drayton Park. As a crisis house, you need to take referrals 24 hours a day. The team are hearing about the referral and doing that within the trauma-informed model that we work from. And if we feel and hear from that referral that a woman is in crisis, then we would offer an assessment as soon as we can. As a crisis house, and any crisis houses, really you can't work very much with people who are feeling like hurting someone else, because women come and stay voluntarily with capacity and consent. So really most of the time, all the women who are staying at Drayton Park are feeling they'd like to end their lives, or they're depressed to the point where they can't really take care of themselves at the moment, and lots of women have experienced urges to self-harm.
They collaborate well, very professional, give you one-to-one sessions where needs to be. They're very kind and responsive, and they look out for you during your course here.
Every woman who stays here is offered 2 one-to-ones a day. The cornerstone of the therapeutic intervention really is one-to-one time, not so much group time. To do kind of group therapy or group work, you really need to establish people getting to know each other. In a crisis house, it's a high turnover, so the model is all the women, if you were staying here, all the women are offered a one-to-one in the morning, a one-to-one in the afternoon, and some of those one-to-one sessions will be about, I'm losing my housing, my benefits, really intense practical things that are incredibly stressful, but they also might be revealing details of childhood sexual abuse, talking about current domestic violence. So the one-to-ones are therapeutic and practical, and really what the woman needs to talk about in order to kind of recover from the crisis. And we try and think outside of the mental health system. So in Camden and Islington, it's a very rich resourced area with lots of kind of creativity, lots of alternative services. So really trying to enrich that woman's life and introduce some new ideas, because that's how we could take care of all our mental health.
I do recommend it immensely, and people take advantage of it, because we want as many clients come through it as possible, so that the system doesn't get stopped or closed down.
There is a new time, there feels like a new culture, with the CQC being really interested in sexual safety. A new drive, the Women's Mental Health Task Force document has just been released. So I think there is a time for re-looking at how we provide women's mental health services. And I hope there'll be more Drayton Parks.